Thank you, Chairman. On the topic of how we deliver, Commissioner Carr, you said in your testimony that while the benefits of telehealth are clear, barriers remain from legal and regulatory to connectivity challenges. We seem to be moving as quickly as we are able to, though seems slower to most of us than it should be for connectivity. But on the other authorities, I'm concerned we're not moving as quickly as we need. Senator Murray and I, along with in the House Representative Latta and Dingell, introduced a bill, the TREAT Act, to try to deal with some of the regulatory challenges. You know, we have 7 states that touch our state, and our 2 biggest population centers are right on the edge of the state. Lots of people drive from other states to come to Missouri for health care, but when it's telemedicine and they're dealing with the doctor they've always dealt with, they're in a state where that doctor may have some challenges because of the barriers to becoming licensed in that state. If anybody on the panel, starting with Commissioner Carr, have any thoughts on that problem and the importance of solving it?
Well, thank you, Senator. I think the TREAT Act is a great step in the right direction. It eliminates some of those geographic restrictions that are unnecessary in a telehealth world. Speaking of Missouri, though, I also want to say that one of the challenges on the connectivity side is workforce and make sure we have the telecom crews capable of building this out. And I just did a visit to Lynn, Missouri. They've got State Tech there, which is a wonderful program, training up young people to get good paying jobs, building out this infrastructure. And as a country, any infrastructure plan that doesn't include a plan for workforce shortage that we have is itself falling short. So I think that type of a program in Lynn, Missouri is a great model we need to continue to build on.
Right. Well, I agree with that. But in fact, in our state, the University of Missouri has had extension opportunities, early on very much ag focused, but later that focus expanded in every single county. And one of the things they're doing right now is trying to be sure that there's at least one location in every county that someone could go to for a telemedicine opportunity. Often your behavioral health provider is further away than your other health provider, and that's something you don't want to let get away. But if anybody has any thoughts on the challenges, last year we saw kids in college in a different situation than they had been before. Maybe these were people that had behavioral health people that they'd relied on at home, but suddenly they're 5 states away. How important is it that we figure out how to deal with that problem? Ms. Larson?
I would speak to licensing is really a barrier. As you talk about these specialists, they can provide, there's always a place that is needing them. And if there's a lot of barrier to getting not only licensed in the state and the time that takes, some states still require them or want them to come into the state and be fingerprinted. The duplication of that for an individual, a physician who's very busy, to get all of that done across several state lines is difficult. Not to mention, typically, at least the way we provide telemedicine, we do the credentialing or appointment, if you will, with whoever the local providers are. That means that medical staff, through the conditions of participation, are required to have medical staff appointment criteria. Each of them are different. I have ED, emergency physicians, who are appointed in 200 locations across the U.S., 200 different sets of bylaws that they have to be accountable to achieve and accomplish and keep up in 200 different facilities. That's just the governance at the local site that's required by the conditions of participation.
Well, I think I'm running out of time here. I think this is something we have to deal with. I had a Zoom meeting this week with a group, the American Connection Project, 170 different members, big companies and others. The TREAT Act is the first piece of legislation they've ever endorsed, and so they endorsed it this week. And I hope we can deal with that, because if we have telemedicine, we're going to have connection to the doctors and other healthcare professionals that you want to be connected with, and that you often are connected with when you get in your car and drive. but every state has somewhere in the state that someone from another state drives to see their doctor now, and we need to figure out how they can have that telemedicine visit as well I think you can make considerations, as the TREAT Act does, for state regulators to still have authority if things are not going the way they should, but some sort of understood reciprocity or something is really important here. Thank you, Chairman.